Mucopolysaccharidosis. So here we are in the third part and we are continuing with the Morquio syndrome A. So here the MPS which is defective is the MPS 4A, and the enzyme defective is the galactosamine 6 sulfatase. Then comes the gags which are affected. So the gags which are affected are nothing but the keratin sulfate as well as the chondroitin 6 sulfate. Next, looking at the symptoms. So symptoms here, it involves the skeletal dysplasia as well as there is the stature is short, that is a short stature is seen. Next, we are looking at the Morquio syndrome B. So here the MPS involved is the MPS 4B, and the enzyme which is defective is the beta galactosidase. Then what is the gag which is affected? The gag which is affected is the keratin sulfate, and the symptoms, it is similar to 4A, that is a skeletal dysplasia, as well as there is the presence of short stature. Next, the disease you are looking is the Morquio-Lamy syndrome. So here the MPS involved is the MPS 6, and the enzyme defective is the N-acetyl galactosamine 4 sulfatase. Next, moving on to the gag which is affected. The gag affected here is the dermatin sulfate, and looking at the symptoms, what are seen is the curative of spine, there is short stature, there is a skeletal dysplasia, as well as there is the cardiac defects which are very prominent.